I'm Jack Parker with Parker Cornea, and this is a video-informed consent for this procedure, cataract surgery. Cataract surgery is probably the most common procedure performed in all of medicine everywhere in the world. It's the definition of routine, but still, it's a real surgery, and that means we have to discuss the risks, benefits, and alternatives to the procedure. So the cataract itself is the natural aging and wearing out of the lens inside the eye. The lens, over time, like all things, develops wear and tear, and it stops doing its job of focusing light crisply and cleanly into the back of the eye. And when you start noticing the quality of your vision and the quality of your life suffering as a result of those changes in the lens, we can exchange the lens you have in your eye. And that procedure, the lens exchange, your old worn out lens for a new implant lens, that's cataract surgery. Cataract surgery is the only treatment for a cataract. If the lens in your eye is not functional, the only treatment is to replace it with a new lens. And the potential benefit of that operation is improving the quality of your vision over time. Other things that we can do at the time of surgery that can be of benefit to you is to reduce your need for glasses or contact lenses after the operation, depending on what lens you choose and whether you have any astigmatism in the eye that we're addressing at the time of the operation. The risks of cataract surgery. Whenever you have any procedure anywhere in the body, there are things that can go wrong. And that applies also to cataract surgery. Before the operation, the anesthesia that we use, typically the anesthesia does not pose a large risk when you're having cataract surgery. We don't usually put you to sleep. We don't usually give you an IV when the procedure is being done here in the office. Typically, the way that we anesthetize the eye is with numbing medicine around and inside the eye, and with pills you take by mouth which keep you calm and comfortable during the procedure. But still, even with this relatively light anesthesia, you can have bleeding, you can have drooping of the eyelid, you can have loss of the vision of the eye, you can have loss of the eyeball itself. Even rarely, you can have life-threatening complications from anesthesia that can be serious, so we treat it quite seriously. With the operation itself, the risks include still having vision that is not great after the operation. If you have other problems with the eye, you can have bleeding, infection, you can have retinal detachment, you can have problems with the implant lens which require more surgery to correct, even many weeks, months, or years after the operation. Overall, these risks are minor, but they are real, and that's why it is important to see your eye doctor regularly after the operation to make sure things are as they should be, and to use your drops as instructed after the procedure, and to communicate if there are any problems that you notice in which things are not going appropriately.